Hey everyone, right now I'm sure that you are aware that there have been stay-at-home orders for most here in the US. We have some talks of possibly opening back up by May 1st, but that's still a tentative date. I know within my own circle several people who are struggling with social distancing, working from home, and the related stresses. And after looking over some of the research, I think it's fair to say that these stresses will be more widespread. The purpose of this video is to help you understand some of the mental health issues that may arise from prolonged quarantine, as well as some of the ways to cope with the situation the best we can. Be sure to check the description for citations and some activities you can do to curb the boredom. Let's start by looking into some of the possible mental health effects quarantine may have. SAMHSA, a mental health and substance abuse organization, has identified several possible reactions to quarantine. Anxiety, worry, and fear are going to be common. Most of us have very uncertain feelings about the future, especially considering that we don't know how this will end. Some of us are losing income or have become unemployed. Maybe we're even worried about infecting others. The American Mountain Guides Association has also put forth a stress continuum I'm putting up on the screen and linking to in the description. You're likely to feel angry or frustrated due to the circumstance. You may even feel depressed given that we don't have much control. You may also feel bored to many normal activities being closed or otherwise unavailable. Symptoms of depression are also likely due to, again, the uncertainty and lack of control we have on the situation at large. Loneliness is another issue that may occur during quarantine. Brooks et al. Had noted that during quarantine, reduced social and physical contact with others was distressing to individuals. Not surprising, I know, but get this. A meta-analysis by Hotline and colleagues found that those with stronger social relationships have a 50% greater likelihood of survival as compared to those with poor or insufficient relationships. They even go further to say that social relationships influence health outcomes. This is something to keep in mind for individuals who are quarantined and also sick. Connecting with them is especially beneficial during this time. PTSD is also mentioned as a possibility in SAMHSA's fact sheet. Brooks and others suggest that those quarantined for more than 10 days show significantly higher PTSD symptoms than those quarantined for less. One of the other things Brooks and associates mention is stigma. This goes for those who have been both sick and quarantined. After they've been released from quarantine, some people reported rejection from friends and family, as well as others treating them differently by avoiding them, withdrawing social invitations, among other things. Again, reduced social relationships can be detrimental, even after people have recovered. Keep in mind, all of these problems can be exacerbated due to prior mental health issues, so be mindful if you have a prior diagnosis. There are several things to help you recognize if you're having trouble during quarantine. Look at your hygiene, for instance. Have you decreased your showers or stopped brushing your teeth for several days when you normally do it every day? Are you using intoxicating substances more frequently? Are you overeating or undereating compared to normal? How about sleeping too much or too little? What about loss of enjoyment in activities you normally love? These can all be signs of an emotional slump. If you feel like you're exhibiting some of these symptoms too long or they're getting too out of hand, you should try to see a mental health professional. A lot of mental health professionals have been impacted due to the virus, but from what I know of the agencies in my area, they've been allowed to provide services, but have to do either telehealth or therapy over a webcam using secure software. This can definitely be a little bit different, but you can still get quality service, and it's definitely better than nothing. The article I referenced earlier by the American Mountain Guides Association also has some notes on resiliency and coping with COVID-19. This is to help mitigate stress one might feel during this time. It's meant for groups, but I'm extrapolating for individual use. First, you need to worry about safety. Physically, of course, but also any safety concerns that need to be planned for proactively. This can mean having an extra supply of medicine ready in case of a distribution interruption or a demand-caused shortage. This also means reducing media consumption, as this can become counterproductive. And, additionally, protect yourself from online rumors and disinformation by fact-checking, especially on social media. This can prevent unnecessary stress, which brings us to our next point, calm space. Having a calm space is important for this time. This means creating time to do something relaxing to get your mind off of work and away from the news. Give yourself some time to be creative, to listen to music, or watch education videos unrelated to COVID-19. Breathing techniques are also recommended in this stage. I personally recommend box breathing, but any type of relaxation technique will do. Empowerment is about finding some sense of control in a time where we don't have much. Set yourself up a schedule, especially for sleeping and eating. If you're a healthy individual and can help by getting groceries for someone immunocompromised, not only are you helping them, but giving to others usually instills a sense of empowerment in ourselves as well. Once more, loneliness is something many of us will come across during this pandemic. We need to make sure that social distancing doesn't create social isolation. We can do this by checking in with others and asking people to check in with us. Trying unique ways to connect is a good practice as well. I've known a few people who've done D&D and poker through webcams. My girlfriend did a live stream of her creating art with other people who were engaged and drawing as well. The internet makes this a lot easier than it was in the past, if you're fortunate enough to have it. For the time being, the post office is still functioning, so if you don't have internet accessible, mailing is still another option. There are several locations and even a Facebook group dedicated to people howling at 8 p.m. in order to stay connected. We just have to be creative. Lastly, inspire hope. Having the belief that there is something on the other side of this encourages behaviors that make that more likely. If you're finding yourself in despair, find something to bring humor and levity, or try to plan what this will look like after the situation, at least the best you can. Giving hope to others is another helpful strategy, and gratitude journals help rewire our brains to focus on positive things during this time. I'll also include in this video's description an article by McGladrey that describes the tools to make a psychological first aid kit. It goes over a lot of what I just covered, but it goes into a little bit more detail. SAMHSA also has some advice for coping with the situation. Simple things such as stretching, deep breathing, meditation, praying, and regular activities you enjoy can help you relax. If you had contracted COVID-19 and are worried about the stigma I mentioned earlier, it's recommended that you learn about the disease and the risk to others. Your doctor and even the CDC will probably have this information. Sharing this information with others can often reduce the fear and related stigma. My other videos have some coping skills for reducing stress and sadness, but if you find yourself dealing with a serious mental illness, contact your doctor or counselor. There's more that could be done systemically to lessen the financial, physical, and mental impact of this virus. Brooks et al. Points out several policy changes that could be done to improve our situation. However, we need to focus on what we can do ourselves and right now. And as individuals, we can look for resources that already exist and are available right now. In my area, schools have been giving out free breakfasts and lunches to kids. Our energy and cable companies have also provided assistance for people. Unfortunately, I can't provide financial assistance information for everyone, but churches, schools, and social workers are generally good at providing you this information. You can also call the companies that might offer these services for help as well. On a final note, please be patient with yourself. None of us are at 100%, and it's normal to feel frustrated, confused, and uncertain, because most of us are. I hope the one thing you get from this video is that you aren't alone, and I also hope that this has helped you in some way in dealing with this whole situation. Thank you for listening.
You know, my mother used to say, a long time ago, whenever there would be any really catastrophe that was in the movies or on the air, she would say, always look for the helpers.